In continuation to the lecture series on a thorough perception on liquid dosage form, today we will be discussing biphasic liquid dosage forms. I am Dr. Hema Chaudhary. As already discussed in my previous lecture about monophasic liquid dosage forms, wherein we covered internal use, especially syrups, which comes under aqueous category, and elixirs, which are hydroalcoholic internal use monophasic liquid dosage forms. We have also covered monophasic liquid dosage forms meant for oral topical use, under which we have discussed mouthwashes, gargles, sprays and throat paints. Also in my previous lecture, we have discussed monophasic liquid dosage forms instilled in body cavity such as enemas, nasal drops and nasal sprays. Monophasic liquid dosage form meant for topical applications such as lotions and liniments have already been discussed. In my previous lecture series, we have discussed monophasic dosage form meant for topical application, especially liniments, wherein we discuss the formulation aspects of liniments, its compounding characteristics and a classical example of soap liniment IP. And also parallelly, we also discussed another type of monophasic liquid dosage form for topical use, that is lotions, wherein we discuss that how they are different from liniments, its formulation characteristics, compounding characteristics, as well as a typical example of salicylic acid lotion. Now talking about today's lecture series in detail, we will be emphasizing on biphasic liquid dosage forms. Biphasic dosage forms, liquid forms, are generally having two-phase systems. They are also referred as heterogeneous systems. The biphasic liquid dosage forms can be further subdivided based on the type or the nature of the phase, which could be liquid in liquid phase, under which we have oral use and external use. If it is oral use dosage form, we can discuss emulsions, whereas liquid in liquid external use, we would be discussing liniments. The other type of biphasic liquid dosage forms could be solid in liquid type. Now solid in liquid type can be further subdivided into parenteral use, oral use or external use. If it is meant for oral use, we have suspension dosage forms, and if the formulation is intended for external use with solid in liquid type, then it is referred as lotions. Although we have studied liniments and lotions under monophasic type, which are to be homogeneous in nature, also it is important to mention here that the liniments and lotions fall under biphasic category as well. So talking about in detail, the types of dosage form which we will be discussing today would be biphasic liquid and solid dispersions, wherein we will be talking in detail about suspensions. So as already mentioned, biphasic liquid dosage form meant for oral use, wherein the solid in liquid type could be generally referred as suspensions. So suspensions by definition are mixtures, wherein they contain insoluble solids. This is to be mentioned that suspensions are dosage forms biphasic in nature, meant for oral use, having insoluble solids. They can also be defined as heterogeneous systems, thermodynamically unstable liquid systems, wherein an insoluble solid is uniformly distributed in a liquid phase. The dispersed phase, which is an insoluble solid, is generally referred as the dispersed phase, and the solvent in which the dispersed phase is distributed uniformly is also referred as dispersion medium. It is important to mention that the dispersed phase is solid in nature and the dispersion medium is liquid in nature. Suspension may require inclusion of many other excipients which could be physical stabilizers such as suspending agents. Suspensions which are meant for oral use are generally aqueous liquid phase systems. So in concise way of defining suspensions, it can be defined as they are biphasic liquid dosage forms, thermodynamically unstable heterogeneous systems wherein an insoluble solid is dispersed uniformly in a dispersion medium, generally with the help of a suspending agent. Talking about advantages of suspensions. Now, the main importance of going with suspension dosage form is with respect to bioavailability. As already mentioned in the definition, it is a dosage form to carry insoluble solids in liquid form. So, the main characteristic or the advantage of such dosage form is bioavailability. Now, bioavailability of such finely dispersed and wet drugs would be faster than solid dosage forms. So, in other words, if the drug is insoluble, either the choice is to administer as a solid dosage form, which may not be advantageous in many instances because solid dosage forms cannot be consumed by pediatric patients or geriatric patients. So, in that context, suspensions become a choice wherein an insoluble drug can be dispersed in a dispersion medium and the dose of the drug can be administered. So, parallelly, the bioavailability of such drugs can be enhanced when they are incorporated and dispensed as a suspension dosage form. The second advantage of using suspension is administration of large dose of insoluble drugs. As already defined that the prerequisite for a suspension to be is to have a drug which is insoluble. So, if we are dealing with a drug which is insoluble and these drugs are to be administered in larger quantity because of their large dose, it becomes important to mention that suspension dosage form become the utmost choice because large doses of insoluble drugs in solid forms may not be patient compatible. So, for that reason, it becomes easier to administer a large dose of insoluble drugs and this becomes easier to swallow when they are dispensed in the form of suspension. Here, the classical examples is antacid drugs. Antacids are generally large dose drugs which are to be dispensed. So, for that generally suspension dosage forms are preferred for antacid drugs. The other advantage for suspension includes it gives a higher surface area exposure as the suspended particles are generally size reduced and then incorporated in a suspension dosage form. So, when the particle size is reduced and incorporated in a dispersion medium, the particle size gives an advantage of larger surface area, and when there is an exposure of larger surface area, it affects the dissolution in a better way, and because of good dissolution, it gives us better bioavailability. And when there is better bioavailability, definitely there is going to be better therapeutic action. So, for that reason, whenever an insoluble drug has to be administered, the choice would be suspension, one reason being exclusively for the exposure of higher surface area of the suspended particles. The next advantage of suspensions include that drugs which are chemically more stable in the insoluble state are advantageous than they are in solution state. So, sometimes because of poor wetting property of some drugs which makes them insoluble becomes a rescue, especially when such drugs undergo degradation chemically when they are incorporated in solution state. So, suspensions act as an advantageous means of administering such drugs for improving their chemical stability. Another advantage of suspension dosage form is exclusively that it is patient compliance. The reason being that since they are in liquid forms, it becomes easy to swallow. and not only easy to swallow if the vehicle or the dispersion medium is appropriately flavored and colored. The patient acceptance, especially the children and elderly, this becomes an advantage because the adaptability for suspension dosage form will be better. Also, the other advantage for using suspension dosage form is some of the drugs which are insoluble may also have an unpleasant taste. So, in that case, it becomes easier to flavor the dispersion medium and mask the unpleasant taste of the insoluble drug. So, one example here which could be mentioned is paracetamol drug. Though paracetamol tablet is available, but paracetamol suspension could also be a better alternate when better action is desired, and this drug being a bit unpleasant in taste, the masking could be done and a formulation acceptability can be improved. Another advantage of using suspension dosage form is to attain slow and sustained drug action. Sometimes it becomes important that some drugs are released gradually and for a longer period of time in order to avoid repeated administration. In such context, suspension dosage form come to the rescue because by formulating an insoluble drug in a suspension form, one can attain slow and sustained release. Other advantage which can be mentioned with respect to a suspension dosage form is choice of dosage form, especially as it is best choice for administering insoluble drugs and especially in liquid form. So, as already mentioned in my introductory lecture on dosage form, that liquid dosage forms are the dosage forms first of choice as compared to other forms which could be solid dosage forms. The main merit with respect to liquid over solid dosage form would be faster action and also ease of preparation. So, for that, in that context, if the drug under study is an insoluble drug, the first choice which comes to mind for a formulation chemist would be a suspension dosage form. Although we have mentioned lot of advantages of suspension dosage form, there are some disadvantages which cannot be overlooked. To mention few disadvantages of suspension dosage form, in other words, the challenges which one can face while formulating a suspension dosage form, one has to be careful that these challenges should be taken care of, otherwise the formulation purpose would not be served. To mention few disadvantages of suspension dosage form, first and foremost, some drugs have solubility issues, because although we have mentioned that suspension dosage form is mainly for incorporating insoluble drugs, but some drugs may have solubility to some extent in the solvent or the dispersion medium which is chosen. So, that may lead to physical instability on long storage. So, it should be borne in mind while selecting the dispersion medium in context of a particular drug. The solubility characteristics should be well established and interpreted in order to decide which should be the dispersion medium. As already clear that if it is a suspension meant for oral use, generally water is the solvent of choice. So, in context of water, there could be some physical instability coming in with some APIs or the active pharmaceutical ingredient which could be an insoluble drug. So, this becomes one of the concerns for a formulation chemist if you are working on a suspension dosage form. The second challenge or the second disadvantage could be the small size. Although we mentioned that smaller the size of the disperse phase, it is more advantageous because it gives better surface area exposure. On the contrary, it is also important to note that smaller the particle size, larger becomes the surface free energy. So, when larger the surface free energy, it makes the system unstable. So, for that reason, an optimum particle size of the insoluble drug should be selected. So, in other words, The disadvantage could be quoted as that the small size drug particle makes the system thermodynamically more unstable, and because of larger free surface free energy it may lead to aggregation, and when the dispersed particles aggregate together they lead to separation of the dispersed phase from the dispersion medium. So in other words, it leads to sedimentation, so which is not a preferred context when a stable suspension is desired. Other disadvantage to be mentioned in context of suspension is that some drugs might show change in physico-chemical properties on size reduction. So for this reason it is very important to note that if the approach to enhance the wettability of an insoluble drug to incorporate in a suspension dosage form, although size reduction is one of the preferred methodology, parallelly one has to understand that what will be the effect on its physico-chemical features. Some drugs have shown that on size reduction they bring about changes in their physico-chemical property, solubility characteristics, which may affect the stability of the formulation on its storage. The next disadvantage which is important to mention is that although the drug, which is the dispersed phase in a suspension dosage form, is insoluble state, this may become more palatable, because when on the one side we are size reducing the particle to have better wettability, at the same time its better surface area exposure may create a challenge for acceptance because of its bland or unpleasant taste. Its contact with the taste buds becomes better, and this may lead to making the preparation unpalatable. And also one more disadvantage is that because of lesser particle size, more surface area, the dispersed phase may absorb other excipients such as flavors, colors, and the system may become very difficult to formulate. One side where we mention under advantages that in suspension dosage form the dispersion medium can be flavored, colored and made more palatable. On the other side, under disadvantage, if the particle size of the dispersed phase is not controlled, then it could create one more challenge wherein all the added excipients or the organoleptic additives specially may get absorbed onto the dispersed phase surface and may bring in instability in the formulation. The next disadvantage is especially on addition of preservatives. As already mentioned, that suspension dosage forms meant for oral use are aqueous based, and water being the choice of solvent, in some context it is seen that when a preservative is added to such systems to make it more stable, because on long standing water supports microbial growth, so it becomes pertinent to mention that a preservative should be added to a suspension dosage form to have better shelf life of the product. But the reason of concern here is when a preservative is added, it might get absorbed to the finely distributed dispersed phase drug because of larger surface area. So this may lead to depletion in the concentration of the desired preservative which is added, and on long run the instability can seep in. The next disadvantage with respect to suspension could be uniform redistribution of the sediment. This is very important because ultimately when a dose is measured, a dose should be accurate, and that is only possible when the dispersion is uniform, or in other words the dispersed phase on shaking redisperses thoroughly and uniformly in the dispersion medium. So here it is important to mention that when the particles of the dispersed phase come together, they might be in a state that on shaking it should redistribute uniformly and easily. So in other words, such suspensions are generally referred as flocculated suspensions. So flocculated suspensions are always the preferred type of suspensions. The next disadvantage is rate of absorption is slower than solutions. So when we look at one side of the coin, there is other phase as well which cannot be neglected. Although we mentioned that suspensions are going to show better bioavailability in comparison to solid dosage forms, at the same time suspensions will have slower absorption as compared to pure solutions. But this can be tolerated because the drug which is under study is already having insolubility problem. So obviously such drugs cannot be forced into solution state, and if they are preferred, they would be preferred to be formulated in suspension state, which is also a representation of liquid dosage forms. Having discussed the definition of suspension, having discussed its merits, that is advantages and disadvantages, it is now important to understand how the suspensions are classified. There are different ways by which suspensions can be classified. The first basis of classification of suspension is on the basis of particle size of the dispersed phase. Now, based on the particle size of the dispersed phase, it is further subdivided into colloidal suspensions or as coarse suspensions. The second basis of classification of suspension is based on density of solids. Now, density of the dispersed phase or the insoluble drug. Generally, they are subdivided into suspensions containing indiffusible solids and suspension containing diffusible solids. The third basis of classification of suspensions is based on arrangement of suspended phase, that is the dispersed phase. They are subdivided into either flocculated suspension or deflocculated suspension. And the last basis of classification of suspension is based on route of administration. So suspensions can be subdivided either meant for internal use or they can be subdivided under route of administration meant for external use. Taking each type of classification in detail, so first, based on particle size, the classification as already mentioned, the suspension can be either colloidal suspension or coarse suspension. When we talk about colloidal suspensions, these are generally preparations wherein the dispersed phase or the insoluble solid particle size is generally less than 1 micrometer, and if it is a coarse suspension, the particle size of the dispersed phase will range from 1 micrometer to either 50 or 75 micrometer size. As already mentioned, one understanding which is to be borne in mind is that it is not always advisable to go with very fine particle size, that this will give better surface area exposure and in turn better bioavailability. So based on the drug which is under study or the drug which is to be incorporated in the dispersion medium, one has to decide what should be the optimum particle size. So the suspension can be formulated even with a particle size of less than 1 micrometer, or a suspension can also be formulated where the particle size can be up to 75 micrometer. Talking about second type of classification of suspension based on density of solids. Now, as the drug is always an insoluble solid which is the dispersed phase, there can be sub-classification that suspensions which contain diffusible solids or suspensions which contain indiffusible solids. Thank you.